This is week 2, part 2, venipuncture equipment. All right, so we're going to start talking about the additives that go into those tubes, those evacuated tubes. First, we have anticoagulants. Those are the substances that prevent blood from clotting. They do this by two ways. One is precipitating calcium. So basically what that means is it's filtering out the calcium out of the blood, because remember, calcium is one of those clotting factors, okay? And it can also stop clotting by stopping the formation or inhibiting the formation of thrombin, which is a clotting factor, okay? So if it takes the calcium and binds it up, and then it stops the thrombin from even forming, then that blood in that tube will not clot, okay? I'm sorry this slide is kind of like this. I don't know why when I transferred it over things happened, but the other version is there for you to look at, okay? In the content section under week 2, okay? So again, you need to know that an anticoagulant, anti meaning against, coag means clot. So this is a substance that is going to stop the blood from clotting, okay? You also need to know that it does this in two different ways. It either binds up the calcium or it stops the formation of thrombin. Now, where it says types, you have EDTA. We're not saying that word. I'm not even going to try. Citrates, heparins, and oxalates. Okay? Here, I'll write those out for you. So you have heparin. These are the ones that you can't see. Oxalates. Okay? Now, each of these are going to they're either going to bind the calcium or they're going to stop the thrombin, okay? You need to know some of these, and you need to know how they stop the blood from clotting inside that tube, okay? So because the cells are free flowing and not clotted, a specimen collected in an anticoagulant tube can separate through settling or when we put it in the centrifuge, and can be resuspended by intentional or inadvertent mixing of the specimen. So what that's saying is when we have a whole blood specimen, that means this is exactly like it's flowing through your veins, because there's an anticoagulant inside that tube that keeps it from clotting. Well, gravity takes hold and those formed elements sink to the bottom of that tube. So before we want to test the blood, we would mix that tube for up to 2 minutes before we ran any tests on it to make sure it is looking again like it's free flowing through our bloodstream, okay? The other way that it can separate is when we put it in that centrifuge, that machine that spins really fast. And we're going to learn how to use one later on we'll talk about in lecture, and we will do that in lab, because that is an important part of your job, is understanding how to work the centrifuge, okay? But we'll talk about that later. We're going to get back to the tubes here. All right. Here are some important things to know about anticoagulant specimens. So that is blood that has been collected in this anticoagulant tube, okay? They must be mixed immediately, okay? We must mix them gently because that prevents hemolysis, okay? If you've already watched one of the videos this week, it talks a little bit about hemolysis in there, I believe. But what hemolysis is, hemo meaning blood, lysis meaning burst, destruction, okay? That is a bursting of the red blood cell, okay? So we don't want to shake it up. We want what we call an inversion. And that picture there is just a gentle rotation back and forth. Okay. We do this about, okay, I say we do this about 8 times, the gentle inversion, right? Because we want that anticoagulant to be well mixed and coat all of the cells so that we don't get any kind of clumping. Because if we don't mix it well, clotting will happen within that tube. And then that not only messes up the test results, but it can clog up the machine, okay? And lab technicians don't really like that. Trust me, I was one. So, now, for testing purposes, we say that the number varies by the manufacturer. Okay, so the manufacturer who made that tube with that amount of additive says that this is the optimal amount of times that you must invert for it to be well mixed. Okay, but again, a general rule of thumb is about 8 times. Okay, you can't go wrong with that. And this needs to be done. That's why we learn our skills here in lab. And one of the biggest skills that you don't even realize that you're going to learn and may take a while to learn is holding your hand completely still while doing another skill and not moving that needle. Because when you pop that tube off, you're immediately mixing it before you put it down. But you got needle still in the arm, so you cannot move. Okay? And we'll learn all about that in lab, okay? All right. So this is really important, okay, guys? Light blue top tubes, they must contain a ratio of 9-to-1 blood. So that is 9 parts blood to 1 part anticoagulant. And the anticoagulant is this portion right here at the bottom. There is a liquid there, and it must be well mixed as well. If you draw in this tube here and you do not at least get to the minimum here, it will be rejected every time. This test has very specific parameters, and that additive is it can skew the test results if the ratio of blood to additive is not correct, okay? So we always want to try to get it between the middle and the maximum there. And then there are 2 different sizes that allow less to be drawn. So making sure you get the right size for your patient, right? If you have an elderly patient, a hard stick, or a little kid, all kind of special circumstances, you might want to get that tube that needs less blood, right? So that you're not having to worry about filling it all the way up. But you will find we do this test a lot for people who are on blood thinning medications, and they come in like once a month to make sure that their blood thinners are at a therapeutic dosage. And what I mean by that is we're making sure that it is not too thin or too thick, basically, so that their blood's not clotting up. And we're making sure that they're not having, their blood is so thin that they have internal bleeding, okay? Another very important thing for you as a phlebotomist to remember, one of the questions we're going to be asking is if they are on blood thinners, okay? Now, the reason why we ask if they are on blood thinners is because if they are on blood thinners, that means that they're like Coumadin, heparin, anything like that. That means that when we draw their blood, we need to put extra pressure. We need to get an extra bandage or use the Coban wrap that holds it a little bit tighter, but not too tight. And we need to take extra precautions to make sure they're not bleeding before they walk out the door, okay? All right. So we do have special use anticoagulants. I'm not going to get deep into these here because we talk about these more in one of our other parts this week, okay? I do want to talk about anti-glycolytic agents, okay? Let's break that word down. Anti means against. Glyco is sugar, or we'll just call it sugar, okay? And lytic, remember, is this similar to lyse, destruction, okay, breakdown. So glyco, glucose, yeah, sugar. I couldn't think of the word right then. All right. So anti-glycolytic, it is preventing. So if we have glucose breakdown, so glycolytic, anti, that means it's stopping the breakdown of glucose by the cells, okay? So the most common additive that does this is sodium fluoride. This will preserve the glucose for up to 3 days and prevent bacterial growth, okay? This is also used in conjunction with potassium oxalate, okay? We use this together for when we are doing alcohols, blood alcohols, also certain bacterial tests. We're checking for certain bacterial. You'll see these two combined, okay? All right, the next one we're going to talk about is the clot activators. Those are substances that enhance coagulation in serum specimen tubes. So remember we talked about serum comes from blood that has clotted, and plasma comes from blood that has not clotted. We haven't talked about that yet. Here it is. But we're going to talk way more, and the reason why I haven't gone in depth with this yet is because we're going to talk about it more again in another part of this week's lectures, okay? So we do need to know that clot activators are substances that provide more surface area for the platelet to activate, right? So the platelets are like, oh, there's an injury. We came out of the vessel. Things are not right. And they're looking to stick to something to clot, okay? Now, this actually happens naturally, but that can give you a visual of what those clot activators do, what their job is, okay? So the first one that we're going to talk about is the glass particles. You do need to know another name for glass particles is silica particles, okay? And those are a just slightly different version. You know those parts are those little packets that come in like purses, stuff like that. You know, have the little balls. Those are like silica. So this is a kind of a version of that, but on a microscopic level, okay? And then you have inert clays. We really don't talk about that too much, other than just knowing that it's out there. And then we have clotting factors like thrombin. So that means that they have taken a clotting factor that the body produces when there's injury, trying to work on that clotting process, and they have added it to the tube. That chemical, it looks chemically similar to what our body does, basically. Okay? So blood in an SST tube or a serum separator tube, and we'll talk more about those later, will eventually clot without mixing. When it's not mixed, however, when it's not mixed, the glass particles are going to get stuck, and it could interfere with the testing process. Basically, if you don't mix those tubes well, because you're like, oh, they clot anyway, the blood clots anyway, so I don't really have to mix it. And you don't put as high priority on mixing it as you do whole blood, those little glass particles are not going to be coated in the clotting factors, in the platelets, and things like that, like it is supposed to, basically. And it can mess up the analyzers and cause you to have to do another stick too, probably. So Make sure you put priority on mixing all of your tubes, no matter what is in the tube, okay? All right, let's talk about thixotropic gel. You need to know that word. This is the what we call serum separator. So we're going to look, there's some gold top tubes here in the lab, and they have like this thick jelly, like gluey substance at the bottom. That is what that does is we draw the blood, and we're drawing it in this tube that we're going to put in the centrifuge after we've waited the appropriate amount of time, depending on the tube that it is. And when it spins at a certain RPM, or rotations per minute, that gel, they call it a gel matrix, basically kind of moves to the middle. The formed elements go underneath because they're denser than the gel. And then what is left above the gel is your serum or plasma, okay? This prevents the cells from continuing to metabolize substances. So what happens is, even though your cells have left the body, they're still doing their job. And if we are looking for glucose, or if we're looking for cholesterol, if we're looking for different things in the blood, we don't want the cells to be breaking that down and giving us a false impression that this person may be sick or fine and they're actually sick, okay? So we need, just know thixotropic gel is that separator portion, and especially after you see it in the lab and then you see how it works, it makes perfect sense, okay? And then we have trace element free tubes. All I want you to know for all I want you to know for this one is that they're tubes made of materials free of trace element contamination. Okay, we're really going to talk a lot more about these later, but again, in that other lecture where we get really deep into the tubes, okay? So what are trace elements? Trace elements. So our bodies are made, we have metals, we have lots of things that are on that periodic table we learn in science are in our bodies. We have minerals, things from the earth. And we can also have heavy metals from our environment. One of the tests that they do on kids, the lead testing, right? We have to get lead testing done. So basically, these trace element free tubes are tubes that are made of specific material that has no elements that we may be testing for in the tube. Because if you think about it, heavy metals, these trace elements that are talking about, are really toxic in high levels. And so, or even really small levels, it can be toxic actually. So like lead, we'll use lead as the main example, okay? So with lead testing, we don't want any lead in our blood. And then if we have a tube that we've drawn it out that leaches out trace amounts of lead, we may go have this really terrible treatment, or have to, just having unnecessary treatments are not fun anyway, and it's not okay. So we would not want to draw their blood in a tube that could maybe leach out that element, and then they get a false positive, basically. So we are going to draw certain metals, certain toxicology, looking for poisons, things like that, in these special tubes that are free of any trace of those elements. Okay? That's all you need to know right now about those. Okay? We'll talk more about them later. Okay? All right, the order of draw. This is so important. Okay? So, why is the order of draw so important? Over here. Okay? My memory jogger is SCSH I just say it over and over and over. And that's sterile citrate serum, heparin, EDTA, oxalate. And all of the tubes that we learn are going to fall into one of those categories, okay? Is sterile, right? That's for a blood culture. So the blood cultures here, they have it's a sterile procedure. Well, not we take extra steps to ensure that we are not getting any bacteria in those tubes or in those bottles that we use for a blood culture, right? Sometimes we use tubes because I don't want any regular contamination from a regular tube that sits out all day to be in my blood culture bottle, because they're not going to wait for that machine to identify the organism. Once it pops positive that there's an organism or a bacteria inside that bloodstream, they automatically start heavy antibiotics because you have sepsis. They believe you have sepsis. In sepsis, you can have a 50-50 chance of surviving. So they're automatically going to give you really strong antibiotics, and that's taxing on your system, okay? But if that was just, and then they find out in 24 hours that it was just contamination, normal skin flora, normal stuff found on the table, they're going to be, that patient just went through something for nothing. You know, it's not a good thing, right? So that is why we, all right. Another important point to remember in the order of draw is you're not going to have everything on this list every time. So you are just going, whatever you have, you're going to place it in the order it would go. Okay. So say you're not going to have blood cultures to draw every single time. So you're really not going to worry about that, right? But if you have a citrate tube and an oxalate tube, you're going to draw the citrate and then the oxalate. You don't have any of the others, okay? If you have a serum or 3 serum tubes, you're just doing serum tubes, okay? So just, you put it in the order it would go just with what you have there, because you're not going to be drawing all of these things all of the time, okay? So first thing we do is our blood culture, okay, bottle, because of microbial contamination. We don't want to do that. The next one is our citrate. That is those light blue tubes, okay? Next is our serum tubes. The next one are our heparin tubes. The next one are our EDTA tubes. And the last one is our oxalate tubes, okay? SCSHEO. Serum, citrate, sterile citrate serum, heparin, EDTA, oxalate. Sterile citrate serum, heparin, EDTA, oxalate. SCSHEO. That's my memory jogger. So I hope it helps you guys too. All right. I will see you guys soon. The order of draw is so important because you're going to be tested on the rationale behind it. You're going to need to know, why do I need to draw these tubes in this order? Because it can affect greatly patient test results, okay? And then you can also use a memory jogger, some kind of saying or phrase, whatever you can come up with to remember the order of draw, okay? And I have mine. You also need to know the order of draw because a lot of other people don't, and often they're asking you what it is. So definitely important to remember, okay? You get tested on it a lot. I know I've even had them ask me the order of draw in job interviews, okay? So very, very important. So let's get into it. It's important to remember that we draw these in that order because we want to avoid carryover and cross-contamination from one additive of a tube to the next, okay? So what happens is blood in the additive tube will touch the needle, that multi-sample needle with the rubber sleeve, and then get additive on it. And then you take that one and put it in another tube, and then that one gets that additive, right? So say if we drew a tube that we drew blood in an anticoagulant tube, right? And that anticoagulant got on the needle, got trapped in that rubber sleeve, okay? And the next tube we put on there was a tube, a clot activator tube. So we needed that blood to clot. But then when we put it on to that rubber, that multi-sample needle, we now have anticoagulant and a clot activator inside the tube, okay? Or maybe another issue, we draw that anticoagulant tube and it's EDTA, which binds calcium. And then we're looking for calcium in this other tube, serum tube. And then we've skewed the results, okay? So let's make sure that is one of the major reasons we do the order of draw, as well as think about it, that first one in the order of draw, prevent cross-contamination of any kind, okay? Contamination can happen also when blood is transferred from a syringe into the ETS tubes. So making sure that, again, the order of draw has been found to minimize the risk of interference, okay? Also, we need to fill the specimen tubes from the bottom up to minimize carryover. All right, tissue thromboplastin contamination can interfere with coagulation test. All right, that is talking about tissue fluid. When we do capillary sticks, we always have to wipe away the first drop so that we are not getting any contamination from the tissue fluid, okay? Also, coagulation tests that are drawn in a light blue tube must be filled completely. The other part to that, we talked about that just a minute ago, but the other part to that is it should always be drawn with a waste tube that has a small amount of blood to eliminate tissue fluid contamination. If you're using a butterfly, you must use a waste tube so that the air in the tubing does not contain the sample to be quantity not sufficient. Because remember, those evacuated tubes pull a specific quantity. So if part of that quantity of blood that's going to get you to that sweet spot is filled with air, you're not going to make it. It's going to be quantity not sufficient every single time, I promise. Okay? So drawing that extra tube allows us to get rid of those two issues. Okay? Microbial contamination. Those are microorganisms found on the skin that can contaminate blood specimens. All right, that is, again, what we're talking about with the sterile blood cultures. Okay?